Dinidari Foundation, a non-governmental organization, has called for collaboration and cooperation of every agency on sexual and gender-based violence, SGBV mitigation and response. The foundation advances equal opportunities for women, girls, and youths, empowering them to use their voices to make their decision. The executive director of the foundation, Indikato, made the call on Tuesday at a one-day workshop on collaboration on gender-based violence response in Nigeria, organized in partnership with the National Human Rights Commission, NHRC, and Commonwealth Foundation.
Dinidari Foundation has previously worked on women voice and leadership projects geared towards sensitizing the public on the prevalence of SGBV, the importance of speaking up against it, and the possible ways to address cases. We collaborated with the National Union of Road Transport Workers after getting their buy-in on our project and placed information stickers on tricycles, that's keke, in order to also reach the people at the grassroots. From our intervention, we have learned the importance of collaborating with state actors, educating government agencies, and the key impact of lobbying them for changes that are essential to society. This goes to show that we cannot do it on our own. The NHRC cannot do it on their own. To address the scourge of SGBV in Nigeria, using the institutions that exist to lead the citizens, i.e. government, protect the citizens, i.e. law enforcement, and portray happenings in such a way as to lead to a behavioral change among citizens, that is, the media. We also acknowledge that our society deeply respects our traditional and religious institutions. This is why a part of this project involves us working hand in hand with leaders who represent these institutions.
Kato said the foundation in 2020 collaborated with the Commission to address the human rights issues identified during the response efforts to COVID-19 in Nigeria.
In 2020, we collaborated with the Nigerian government, that's the National Human Rights Commission, on the human rights response in COVID-19 response in Nigeria. During this, the National Human Rights Commission noticed a great spike in the number of SGBV cases as the country was forced into a lockdown. In fact, the National Human Rights Commission had to call it an epidemic within a pandemic. Under this project, priority was given to sexual and gender-based violence response, making it a forefront national issue and fostering interagency cooperation across the tiers of the Nigerian government, facilitated on this end by the National Human Rights Commission and Office of the Vice President and supported by international organizations.